this next plant that I'm going to talk about fits some of the criteria that make me really like first aid plants. So in other words, I consider it a very valuable first aid plant. The first criteria for this plant that makes it invaluable for me is that it's weedy in my garden. So by being weedy in my garden, it means that I can gather lots of it, which is reduced the cost, since first aid usually you don't make any money. And so if anybody saw the segment where we went around the garden, you will see this plant just sprouts up all over the place here because it's wet. And this plant is a non-native plant. It's native to Europe. So I'll give you a few hints and see if you can guess it. So if you saw the segment in the garden, it won't work as well. So it's weedy in wet places. It makes a very nice smelling flower. The flower smells very different than the roots, which some people have disparaging comments to say. And it's often used as a nervous system aid. And what is that plant? Apprentices?
Valerian.
So that's right. So it's valerian. I use the non-native valerian because that's the one that grows here, and that's Valeriana officinalis. And that's just the old name for the plant. It's in its own family, the Valerianaceae. It's not a very big family. Valerian is the largest genus in that family. But the Valerianaceae, for you botany folks out there, is pretty closely related to an Asteraceae. So Valerianaceae and Asteraceae probably derive from the same evolutionary origins. And actually, if you look at the flowers of the valerian, you can see that it resembles the disc flowers of an Asteraceae. So it's just, it's all accumulated also on one head. It's just something to consider. It's something to enjoy looking at. So we're talking about Valeriana. Now, once again, there are many species of valerian that grow in the United States that are native. There's Valeriana capitata, Valeriana tuberosa, Valeriana occidentalis. I haven't used those other species as much, but people who live in those regions often do use the native valerians, and so they can be used. It's just a consideration. I'm gathering a non-native weedy plant in my garden, so that means really there is no consideration about gathering it. I mean, I pull it out, it's weedy, it comes back. It's beautiful. If you're gathering a native plant, you just all of a sudden you have your wildcrafting considerations. But in many places, the Valeriana species is pretty common. It's the roots that are used. I only use the roots. So that's the part. So you have to kill the plant to take it. The roots are not very big, but we'll see photographs and some video on valerian. So valerian is one of those plants that gathering it is usually pretty easy in the sense of the roots don't go down very deeply, and a hoary will easily be able to gather the roots. The difficulty with making valerian medicine is washing them, which just takes, there's a lot of small rootlets that come out and a lot of dirt gets caught up in there. So you have to wash them well. Don't scrub, by the way. In general, don't scrub your roots. You want to just clean them with your fingers or with a not very abrasive tool, because otherwise you're taking out the outer skin off them. And often the plant parts, once you do that, the aromatics get released, which is important in valerian. So wash them, and then I blend them in alcohol, 1 to 2, 95% for my tincture. And then I also blend valerian in vegetable glycerin to make a glycerite. So I make a tincture, 1 to 2, 95% blended, and I make a glycerite where it's something about 1 to 2 as well, but I'm blending it in vegetable glycerin rather than alcohol. The beauty of that, as many of you can imagine just thinking about it, right, is I've talked about one of the first questions you ask anybody before you give them an alcoholic tincture is, do you have any difficulty with alcohol? And most people say no, but the occasional person, it's important to recognize this, will say, yes, I can't take any alcohol. Well, if that person's in a lot of pain, you might not have a lot of options. So one option to carry with you, and a very stable option, meaning you can carry it for long periods of time and it stays stable in this solution, is valerian glycerite. So I'm suggesting that everybody makes some valerian glycerite, which means valerian, fresh roots. I blend it in vegetable glycerin. It just makes it really useful for the things I'll talk about with valerian, useful medicine for people who can't use alcohol. So the roots are used, and valerian, so the roots are used, and one of the things about valerian that's unusual is that the roots are the aromatic part of valerian. In many plants, the above ground portions are the aromatic parts, but in valerian, which is a perennial, it's the underground roots that are aromatic, which means aromatics stored in a bad way, aromatics chopped up in a way, there are ways that you can destabilize the aromatics of plants. And so you want the aromatic aspects of valerian. So that means that when you make medicine with it, you want to make the medicine fresh as possible so that those aromatics from the roots go right into your vegetable glycerin, they can go into your oils, if you make oils out of valerian, or into your tincture. Personally, I think that fresh valerian works much better than dried valerian. It's a plant where, like sometimes I think maybe fresh and dried work. I think that sometimes the dried valerian doesn't work and causes some side effects that are just not wanted. So fresh valerian is what I recommend in all preparations, which means that many people who take valerian in capsules, they're getting the dried plant and they find that it might not be effective. So just to be clear, some people love dried valerian capsules. It works for them. So I'm not saying across the board dried doesn't work, but I am saying that I think that the fresh works much better. So instead of, if somebody really needs valerian, instead of giving them dried capsules or tea of valerian, I'm suggesting fresh plant tinctures like glycerins and tinctures in alcohol. And here's one of the most important things to know about valerian, besides what it's used for, which we'll eventually get to, is that valerian, I see more negative side effects to valerian than any other plant I regularly give. To say it again, I see more negative side effects. I give a lot of plant medicines, and valerian by far has the best track record at negative side effects. They're very common, and I've been asking people now for 12, 15 years whenever I teach who has this effect. And I'm guessing it's something like 1 out of 12 people. 1 out of 12 people is a lot of people that have side effects. It's not one of those crazy 1 out of 12,000 people, eye fallout or something. This is a very common side effect, which is not about their eyes, with valerian. So I bet some of you watching this know exactly what I'm talking about. And that is, for a lot of folks, 1 out of 12 or something like that, valerian will make you agitated or overexcitable. And right now, John, who's filming this, is pointing to himself. It's rare that I'm in a room of people who try herbs. I mean, if I ask people who never take herbs, there's no response. But if I'm in a room of people that have taken valerian, there's always a few. The last time I taught, it was in Asheville. There was like 21 people, and 4 people raised their hand to who has negative side effects to valerian. So remember, before you give valerian, start with 1 drop. And start with 1 drop in the middle of the day. It won't make perfect sense because I haven't said how to use valerian, but just on the brief part of it, valerian is used to calm people down generally. And its negative effect is that it excites some people. It very clearly does. There's no guesswork here. So for a lot of people, they might take valerian late at night before going to sleep to help relax them to go to sleep. And they've never tried valerian, so they take it that night and you tell them, I don't know, a half dropper full. They take a half dropper full and all of a sudden they are wound up. And you might never see them again except for the angry hate mail that you get from them later on. So the first time people try valerian, they should try 1 drop. Usually you can tell from 1 drop. And they should try it in the middle of the day. So a time where a little bit of like tension or just excess energy is fine, as opposed to late at night. One more time, valerian makes a lot of people agitated or hyper or more excitable than they want to be. So be careful about giving valerian and just try small amounts initially. So now we're going to talk about how to use valerian for the rest of the people. Valerian is a plant that fits a continuum of nervous system properties. It's very small amounts of valerian can be very nourishing for the nervous system. Medium amounts of valerian can be sedative for some people, relaxing them, reducing anxiety. And large amounts can help some people sleep. So when I've talked about pain in the nervous system, I often talk about this continuum of nervines for nourishing, sedatives for reducing anxiety, and hypnotics, sleep aids. For some people, valerian can fit all 3 categories, and it's just a matter of the amount per time and the frequency taken. So the dosage and how much quantity and how often taken. So what I want to start with valerian is what I really think valerian does best, and I think it does better than most other plants that are legal. And that is, valerian is one of the best herbal hypnotics. And by hypnotics, I mean sleep aids. I think valerian helps people sleep when it works. By the way, of course, like any other plant, valerian doesn't work for lots of people. I've got lots of people who can't sleep and valerian has done nothing for. That aside, I would say valerian is one of the best sleep aids. So the dosage is anywhere. The dosage is from a couple of drops to a couple of dropperfuls to throwing away the little glass pipette, bing, and just chugging down, part of your 1 ounce bottle. So I carry valerian on me basically to help people fall asleep as one of the primary ways of using valerian. And so you just have to experiment with dosage with people. Like other drugs that people use to help them sleep, sometimes the amount of valerian that will knock somebody out will also make them feel really groggy in the morning. So if you're working with somebody, let's say I'm doing an outdoor event and somebody can't sleep, they're at a music event and it's too loud and they can't sleep, and so I say, here's an ounce of valerian, drink it till you fall asleep. And they do. They drink half an ounce of valerian, or maybe a dropperful or 2 dropperfuls. Whatever they drink it, they fall asleep. But the amount necessary to shut the mind chatter and shut kind of the ears off to the outside audio will also be the amount that will make them feel really groggy and stupid and tired in the morning. So you have to moderate your dosage. In that situation, what you're going to do is give people herbs to see if you can help nourish their nervous system throughout the day so that they sleep better. Sleeping problems are very common in clinical work everywhere I work. So whether I'm doing first aid work or in the free clinic, insomnia, different kinds of sleep problems are really common, both falling asleep and staying asleep. So valerian, though, is one of my favorite for both not being able to fall asleep, taking enough to pass out, and not being able to stay asleep when people wake up, suddenly at 3 a.m., is to have the valerian nearby and drink some. I'm doing it this way. I mean, a lot of people are just going to do drops or dropperfuls. But, it's just the amount that works for you. So aside from valerian creating this negative effect in some people, the excitability, lots of people, it seems pretty non-toxic. Like I haven't seen people have really negative reactions, like have long-term difficulties with valerian. So it seems a pretty safe herb in that realm. So I think valerian is really helpful. I carry a big bottle of valerian. I'm going to be right back. I'm going to get the bottle and bring it in front of the camera and keep talking. So I'm going into my first aid bag and this is the size bottle I use. It's a little bit dirty. A lot of my first aid kit is dirty. I, by the way, have the axiom of never trust a clean first aid bag. Right? Because if it's really clean, if somebody says, I have a first aid bag and they unwrap everything and it's all very sanitary, clean looking, it usually means they haven't used it before. So it's not really great to have all this dirt on it. It's particularly dirty, by the way. But this way, I can squirt, the tincture into a cup and give the people larger amounts, depending on how much they need. But for some people, they already know that larger amounts of valerian work. So valerian, and here again, no dropper, I just have a squeeze top here. For some people, though, small amounts of valerian will help nourish the nervous system. It works as a nervine. It's just a matter of finding the dosage. And the same is true as a sedative. For some people, valerian is one of the best medicines. Once again, they kind of lose their shite, right? They're just upset and need something to just kind of bring them down. And for some people, valerian works really well there. So as a calming agent. But the other place that I see valerian especially work, so first is as hypnotic and sleep aid. The second place where I see valerian is very effective is for pain. Valerian is a plant that I see really effective for just helping reduce pain in people. For physical pain more than mental pain. But it's one of those plants that I use very commonly when people hurt themselves. So whether it's some kind of accident or a cut or even something like a dog bite, where there's kind of a trauma edge to it, but that physical pain, valerian can deal with very well. I think it's one of the best pain remedies as well as one of the best sleep aids. So in my criteria of what makes a really useful first aid plant, smaller amounts necessary. For some people it works, some people need larger amounts. easy for me to gather and make my own medicine from to reduce the costs of it, and then covering bases. And this covers 2 nervous system bases, helping people sleep really well, and also helping people when they just have a lot of physical pain to kind of reduce the sensation of pain. So like a toothache, you know, with a toothache, you might take the bottle, and once you know the person doesn't react negative to it, just squirt some tincture down them, right? Until the pain just seems lessened. So I'm a huge fan of Valerian. I carry a lot of it. I'm cautious because of the side effect from it. So I always try to drop initially, no squirty bottle into somebody's mouth initially. I use it a lot to help people sleep. I use it often to reduce pain. It works together with lots of plants. You can use it with passion flower for people who have to, so with passion flower and maybe blue vervain if somebody is really tight about something and can't relax. You can use it for things like skullcap and pedicularis if somebody has a lot of skeletal muscle pain and you want to reduce the skeletal muscle pain and just the pain associated with it, like the whole tension in the body, and to help. Well, those are some of the main ways that I would use it. So get some valerian tincture, gather the species that grows around you, make a bunch of tincture because often you're going to use it, and I think you just have a really kick-ass first aid remedy that I would suggest carrying with you in pretty much all your first aid bags because it covers a lot of situations. And so there is valerian for you.